Great. For the sake of time, I'm going to go ahead and get us started, and folks can keep hopping on. I'm Jess Simon. I'm a program manager with AMCHP, and I'm excited to have our three great presenters here with us to answer your questions. I'll pass it to you, Carmen, to introduce yourself, and we'll hear from the other two presenters too.
Great. Thank you, Jess. I'm Carmen Hansen. I'm a senior fellow with the National Conference of State Legislatures, where I cover behavioral health issues, prescription drug policy, and cannabis policy.
I can introduce myself next. My name is Amani Eccles. I'm the Behavioral Health Policy Fellow on the Health Systems Transformation Team at AMCHP, where a lot of my work revolves around mental health and substance use disorder program and policy supports for pregnant people and also cannabis. And I'll pass it over to Dr. Brown.
Hello, everyone. My name is Kiana Brown, and I'm an assistant professor at the Rutgers University School of Social Work, where I direct the Substance Use Research, Evaluation, and Maternal and Child Health Group at the School Center for Prevention Science. My research primarily focuses on substance use during preconception, pregnancy, and lactation from a health equity perspective.
Great, thank you all. We're so excited to have you here. I think we're just going to jump right in with the questions since we have just about 10 minutes and there's a couple of great ones to get to. So the first question that came in during the presentation, and I'll put them in the Zoom chat too so we can all see, is can CPS be called on pregnant women who drink alcohol? Always curious about the policing of cannabis compared to alcohol.
I can jump in and take that question. Please, anyone else feel free to add, but the short answer to that is yes. But as I mentioned, my research focuses on prenatal substance use from a health equity lens. People, or CPS is not typically called on people for alcohol use. They're called, and this is an equity issue. Not that, let me say this first. Criminalizing prenatal substance use is wrong. These are antiquated policies. CPS shouldn't be called. We should treat women. ACOG has been advocating for this for a year, but CPS is more often called on Black and brown pregnant people compared to white pregnant people. And typically the focus is on drugs that they're thinking Black and brown pregnant people will use. So alcohol, you can call CPS for alcohol use, but it's just not the typical thing that's done. And there's no standard. It's by practitioner. Whatever the practitioner decides to do, this is what they do. So they bring their own biases with who they call CPS on and what drug they call for. So
I'd also just quickly add, that was great. I don't have too much to add to what Dr. Brown just said, but there's also, the substances are also different in that alcohol is legal, where cannabis is not at the federal level and varies state by state. And then there's also the element of testing and screening that isn't often done for alcohol, but is available for cannabis use.
Thank you. And thank you, Carmen, for the great resources you're sharing in the chat too. Our next question is for those using cannabis in the first trimester. Is there any data on whether people realize they're pregnant, are using intentionally during pregnancy, or are using knowingly, because they're not concerned about the harms, or if they're trying to treat nausea or vomiting? Amani, I know you talked a little bit to this in the presentation as well.
Yeah, and I'll let Dr. Brown follow after me because all the research you do on this topic. But I will say, with speaking to states, specifically state health departments and Title V professionals, what they're hearing from their communities is nausea and vomiting are very common reasons why people use cannabis, as well as just like stress and anxiety. So those are two very common reasons why people use it during pregnancy. But I'll let Dr. Brown add as well.
So the great, what you just said, Amani, that's great and certainly true according to the research. when I heard this question, the article that came to mind was the article by Sarah Paul and colleagues. I think it was recently published. I put the link in the chat, published in 2021 from the ABCD study. And this was one of the first rigorously conducted research studies that I noticed in my literature review for my everyday research that examine outcomes based on whether or not pregnant people use cannabis prior to knowing they were pregnant versus after knowing that they were pregnant. So I won't go into the details of the paper because I know we're short on time, but it's a really interesting and well-designed study. So I put the link in the chat on Zoom, so I hope you have a chance to read it.
Thank you. And the last question that came in during the conference presentation itself is there any research or legislation surrounding topical CBD use during pregnancy?
I am not familiar with any, but that's not my area of expertise. Dr. Brown, I'm sure, would be the most knowledgeable on that one, but I have not seen any laws pertaining topical products with any of the state warning laws and things like that. It's, it just says like use of cannabis. It doesn't necessarily get into details about what type of products those are.
Yes, I've not seen any laws particularly pertaining to cannabis, topical cannabis, but I will put a particularly topical cannabis use during pregnancy. But I will put a paper that I've recently co-authored in the chat box on modes of cannabis administration in the year prior to pregnancy amongst pregnant people, in case you have a chance to read that.
Great, you all are such a wealth of knowledge. And I know we have folks that are just finishing the recording and popped into the room maybe a couple seconds ago. Does anyone have questions or additional questions for our presenters while we have them here? Or comments sharing what's going on in your state related to this?
Yeah, if I may, I might jump in just with a question / comment. Let me say hello real quick. Hello. Thank you so much for this really great session. My name's Kat. I work with the Association of State and Territorial Health Officials and spend a lot of my time working with state and territorial health agencies, and we do a lot of discussion around mental health, behavioral health, substance use. And one of the things that just comes up again and again is just how difficult it is to start this conversation with decision makers, lawmakers, the governor's office, and thinking about, I'm really enjoying this conversation, but how to even get people to have this conversation with us, I think in the first place, is something that I really struggle with. Our state and territory teams oftentimes describe it's just such an uphill battle with stigma and misinformation. And so would love to hear thoughts or reactions or even resources, right? How do we even kind of broach the topic? Because I think there's still so much pushback or misunderstanding. I know there's been the criminalization of substance use or mental or behavioral health issues, and the perinatal population in particular. It's such a, there's a lot of thoughts and feelings that are not always helpful in trying to kind of problem solve and kind of figure out constructive paths forward. And so would love to kind of hear thoughts on that stigma or that misinformation and how to really kind of get folks into the room and listening long enough to be able to present kind of the great information that NCSL has or that Dr. Brown has been sharing. So that's kind of what's top of mind for me right now.
I can jump in first with that. I love this question or questions like this because it speaks to translation. What is research if it's just sitting on a shelf, doing nothing for nobody except for the people who's reading it but not translating it, right? So first suggestion would be to join professional organizations, right? This is I'm going to put a plug in for CPDD, the College on Problems on Drug Dependence. CPDD has a advocacy day, right? It's the longest standing science-based research organization in the US that focuses on problems related to substance abuse. So during Advocacy Day, CPDD speaks to translation. We're speaking to the policymakers about drugs and how to promote evidence-based policies, right? So there's more power oftentimes in a group, right? When you're coming not just as yourself to the policymakers or whoever the powers that be are, right? If you're coming on behalf of the group, maybe they will listen more. But also, you can simply call. It worked for me. I, called my state senators and I asked for a meeting with them, and they were very receptive. Well, but the U.S. senators for New Jersey, I spoke with Senator Booker's office, and his staff on this very issue. His staff was very receptive, asked for additional information, invited me to follow up, and now we have an ongoing relationship, right? So there is certainly power in one, because we can't always join organizations and all of that and take part in advocacy days and different types of committees because everyone's overly scheduled and overly booked. So you have more power than you think. But I say all of this to say is start with an email or start with a call. I called in the age of technology, just hoping someone would answer the phone, and they did. So it worked out. So it's just having a conversation with the right people, with the right legislators that will do something about it. Because it's one thing to have a conversation just to keep the conversation going. That's not helpful after a while. I need something to be done. So knowing who to talk to, and literally just starting old school with a phone call or email. It works better than what you would imagine.
I would add a couple quick thoughts on reaching out when there's a piece of legislation that is in your state around this issue. Legislators do like to get information especially if it's something that's new or evolving in the state where they aren't the experts. They might be a banker in their regular life and a part-time legislator. So they're, not as experienced as all of you are on maternal and child health issues. So if there's, an open forums, if your local legislator is active in the health committee, target those committees to share information so they can make, if you have evidence, to help them make evidence-based policies, because that's, ideally what legislators do with the data that's available on topics like this.
That's true. And I'll add one more thing. I know I started off with saying, call your US senator. That could be big for someone. Starting locally is great. I live in Burlington County, New Jersey. If anyone knows where that is, a small town, feels a little rural, but it's not technically rural. I go to my local township committee meetings. Like that's our governance in this township. It's a township committee. There's no council person, they're committee members. And that's in my local town of West Hampton. And when there's an opportunity to translate anything related to substance use and mental health as a community member, I don't think they know that, oh, that's Dr. Brown from Rutgers. That's like, oh, she lives there with her husband. Like that's her husband's, that's his wife. They live around the corner. They see me as a community member, but when there's an opportunity to translate something very local, specific to my town, I just simply volunteer to do that. And it works. Going to your local committee meetings or township meetings, even community organization meetings. It works.
Thank you for that wonderful feedback. A lot of really thoughtful questions and great to hear from you all. We're just a couple minutes over, so I want to be mindful of everyone's time. If you did join a couple minutes late, this Q&A recording will be available on the conference platform for you to watch, and all of the links that speakers shared will be available for you there as well. Thanks everyone, and we hope we'll see you the rest of this afternoon for other sessions and the next plenary tonight. Thanks everyone, take care.
Thank you. Bye.
Thank you.